Good morning, everyone, or good afternoon for those who are in southern states. Thank you for joining our webinar today. Allow me to introduce myself. I'm Anne Livingston and I'm the chair of the Community Care Smart Assistive Technology Collaborative that has been funded by the Queensland Government. And I'm pleased to be moderator for today's webinar, which is focusing on the endless possibilities of using big data to increase the quality and productivity of the community care sector. As many of you know, these webinars are facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. If you've joined us for previous webinars, you'll know that they are designed from feedback and requests we receive through the collaborative. Indeed, the collaborative has many groups focusing on the role of data and data mining and data use to improve service delivery. So today's session is bringing, I guess, a lot of interest for those members of our collaboration. We've got over 2,000 people collaborating on our site, and we're really pleased with the amount of funding that's come from projects, from collaborations occurring from our site. The focus of our webinars is to bring together local, national and international perspectives, both in research and development, as well as in the deployment of smart, assistive and enabling technologies in the community care sector. Global Community Resourcing has extensive international linkages, and we've been fortunate to work on many international projects and with many international and national research entities. We bring this wealth of experience and exposure to the webinars that we hold regularly. Just a reminder, if you haven't formally registered at the collaborative site, it is accessible to all and free to register and be part of. By way of disclaimer, please note that neither Community Resourcing or our funder, the Department of Communities, Disability Services and Seniors, are promoting or endorsing any particular product, research entity or organisation. Rather, the purpose of our webinars is to inform viewers of various smart assistive technologies currently in development, in deployment or being researched. We also welcome any questions during the session, but I will let you know that all microphones have been muted. This is in the interests of recording. But don't let that stop you adding your questions, and your questions can be added to the question pane on the dashboard to the right of your screen. There will be an opportunity for your questions to be answered at the end of the session. At previous sessions, we've been inundated with questions, so the earlier you post your questions, the more questions we can respond to. In this webinar, it's my great pleasure to introduce Dr. Ian Oppermann, who will introduce the concepts around big data and how it's being used or could be used in the community care sector. This webinar will focus on how using patterns and trends from large data sets can contribute to improving our sector. By way of introduction, Dr. Ian Oppermann is the New South Wales Government's Chief Data Scientist and the CEO of the New South Wales Data Analytics Centre. Ian has over 25 years' experience in the ITC sector, and has had a variety of senior management roles nationally and internationally. Ian has a Master's of Business Administration from the University of London, as well as a Doctor of Philosophy in Mobile Telecommunications from Sydney University. As well as this, in his spare time, Ian is President of the Australian National Committee for the International Electrotechnical Commission, or the IEC. Welcome to today's session, Ian, and I'll hand over to you.
Thank you very much, Anne. That is both a flattering introduction and a terrible photograph. I'm now much older and much less grumpy than shown in that photograph. For Queensland listeners, I should actually also point out that I'm a local Maryborough boy. I just happened to wind up in Sydney. The Data Analytics Centre was created in 2015 to address wicked policy challenges. And a wicked policy challenge is complex, it's subtle, and ultimately has people's behaviour at its heart. The range of challenges we look at range from transport optimisation to builder insolvency to domestic and family violence to juvenile justice to children at risk of harm and reforming the out-of-home care system in New South Wales. Data is a way of seeing the world, science is a way of understanding it. And when you bring these two factors together, you create a whole lot of new tools for better understanding the complexity of the problem, to predict certain outcomes and therefore identify modifiable factors of risk, which can then be targeted for interventions. It allows you to explore what-if scenario planning and allows you to evaluate the effectiveness of the systems or interventions you put in place. Part of the great joy of experiencing and exploring a data-driven world is that you can see problems in all of their complexity. It means that you can think about a problem as the entire journey of a child, a family, a household, and think about all the different points you could potentially change policy, change interventions to deliver the outcomes that you're looking for without necessarily just dealing with the problem immediately in front of you. And that's the challenge very often for government, very often for different organisations. Actually embracing the complexity of the challenge and thinking about an entire journey of child, household, family. My presentation today will talk a little bit about some of the thinking behind the Data Analytics Centre and how we've grown over the last 2.5 years, highlight some of the projects that we have worked on, which are hopefully relevant for this audience, but do a little case study on out-of-home care, which really touches on some of the most wicked challenges we face as society. And then finally, a word on privacy. One of the things that is difficult for people to deal with is the fact that the world is actually a very complex place, and the problems we care about are actually very complex. This is a photograph of Brisbane. It was about to be hit by the storms of October just over 2 years ago. And it's really hard not to see that city in a very different context with the storm about to strike it. In every single one of those buildings, there are lights on where someone's sitting at their desk trying to actually simplify the world around them. And we all know the expression, keep it simple. It's another S in there somewhere, but I won't touch on that. But we do that because as people, we don't cope well with complexity. We simplify things so that we can plan, we simplify things so that we can organize, we can simplify things so that we can actually mentally grasp the challenge. But if you look just at this city, every one of those points of light is connected to each other in a building through physical structures, through electricity, through telecommunications. Each one of those buildings is connected to every other building through roads, through sewage, through different networks. And it's really hard not to see that city in the context of a much, much bigger environment, which is the storm in this case. And in the short term, we call that weather. In the long term, we call it the climate. And when we're making plans and when we're trying to understand things, if we simplify away the complexity, if we take away all of the richness of the problem, then we typically, which is what we typically do, we run the risk of addressing the wrong challenge or addressing a challenge which we can optimize, but only through that lens and not see the consequences of that activity on other areas. And just as this diagram is speaking to complexity and the importance of thinking about as much of the system as we can cope with, if we think about the services we deliver to human beings, the policies we put in place, the different ways of addressing someone, unless we consider the journey or as much of the journey of a child, their family, a household, and think about all the different touch points that we can see through the lens of data, then we again run the risk of just addressing the challenge in front of us and not thinking through that entire journey. It also means, though, that if there's an intervention or if there's a policy reform or if there's a service that we can deliver which is actually outside of the scope of focus that we've got, then again, we run the risk of delivering either the wrong service, a mismatched service, or something which is not as effective as if we could reach across those agency boundaries or reach across those silos. Data is a way of seeing the world. Data allows you to see through barriers, it allows you to see through agency silos, it allows you to see through the walls that exist in many different organizations. And when we think about what's happening to us as a society, we are living in an ever-increasing, ever more digital world. The irresistible digitization of the world around us means that there are far more sources of data that we can use to bring greater insights to challenges, greater insights to problems. It also means that we've got new ways of delivering personalized services and getting down to the needs of the individual. Google does it, banks do it. Most of the commercial organizations of the world deliver new types of services by taking advantage of that irresistible digitization. As government or as organizations who deliver services to people, then the opportunity also exists for us to better understand the problem, to better understand the risks or predict outcomes associated with someone's journey or the impact of a service, and allow us to explore some of those what-if possibilities. The world we live in, of course, is not just complex, it's also becoming more crowded. Today, the United Nations estimates that we have 7.6 billion people living on the planet. The United Nations estimates that by 2050, that number will increase to 9.6 billion people. That's an extra 2 billion people in the space of 32 years, or one generation. And not only are we talking about increased population, we're actually talking about a change in the way people are living. More and more people are living in urban environments. In 2009, for the very first time as the human race, we became an urban species, with more of us living in cities than any other environment, for the first time in human history. The rate of urbanization is accelerating. So by 2050, when we talk about an extra 2 billion people living on the planet, most of those people will live in cities, and the rate of urbanization is accelerating quite dramatically. And that has very substantial implications for how we deliver services like education or health, how we live with each other, and a whole range of different challenges and opportunities that are created by that. We're also aging. As every single day we live through, the population on the planet is aging, and that rate of aging is actually accelerating. So again, that has implications about the type of services and the sort of things that we would need to deliver. We're also operating in this world with the same amount of land, water, air, and natural resources that we have now. So we're talking about an extra 2 billion people living on the planet with no more air, no more water, no more natural resources. We have what we have. So we're also challenged with a productivity challenge and a sustainable intensification challenge. That's the physical world. That's the world we live in. But when we think about the digital world, and I referred to irresistible digitization, more and more of what we see of the world, we see through the lens of data. And if you're creative and ambitious, you can bring data sets from a wide variety of sources and create a joined up understanding of the physical world seen through the lens of data. What the Data Analytics Centre does is work with agencies and work with different groups to try and address these wicked policy challenges, those complex, subtle, and very human-centric problems through the lens of data. The way we do it is to say, just imagine you have any data set you could possibly want, any data set you could possibly think of. It's all joined up, it's all connected. What are the questions that you would ask of the data which have the characteristics of, if you knew the answer to this question in real time, if you knew the answer to this question, what would make the biggest difference to the way you deliver your service, understand the problem, explore different possibilities of interventions, looking for those most effective interventions, or evaluate the effectiveness of something you've tried. That's our blue sky promise, and we push and we push and we push agencies to not just think about the problems that they have right at the moment, not just digitizing the way they currently do things, but helping them to think about what they could do to fundamentally change how they deliver that service. Not just an old thing in a new way, but delivering a new thing in a new way to try and address that fundamental challenge in the context of an aging, growing population and sustainable intensification. That's our blue sky. And then we come back to deliver a proof of concept, which allows the agency to explore one of those powerful questions at one stage in the journey of a child, a family, a household, a community. and give them back a predictor. So these are the factors of risk, these are the modifiable, these are the non-modifiable factors of risk, and this is what we predict will happen to a cohort in these circumstances. A classifier, one of these or one of those, which is particularly good for things like fraud or fraud detection. A what if scenario planner, what if we did this, what if we did that, and held all these other factors constant, or the ability to evaluate an intervention that's happened in the past. And we give these tools back to the agencies. We allow them, after we've digitized and linked and modeled, we allow them to start to explore the predict, the personalize, and understanding the different sorts of interventions, different sorts of services, different ways of delivering things through the lens of data. So fundamentally, data science is about productivity. One way to look at it is, how do we better understand the problem? How do we better predict outcomes or identify factors of risk which lead to outcomes? How do we explore the what-if scenarios in a digital equivalent of the physical world? And how do we evaluate how effectively we've delivered a service or how effectively we've had the impact that we've wanted to impact? And we do this in an agile way. We're government, therefore we're agile. And I'm sure everybody else around the table is just as agile as we are. In the world of agile, there are several different concepts. The first is a proof of concept. The idea is, in a short, sharp burst of activity, you bring together different components which prove the concept of what you're trying to deliver. And then in an agile fashion, deliver, you finally come up with what's called the minimum viable product. Now, in our case, we're trying to solve problems that have never been solved before. There is no answer to domestic and family violence, because if there was, we wouldn't have it. There is no answer to pedestrian safety, because if there was, we wouldn't have road deaths. So we are constantly discovering through the lens of data, building those predictors and classifiers and what-if scenario tools. But after we've delivered one proof of concept, after we've created a predictor or a classifier, we give it to the agency, we put it into their analytical environment and empower them to start to use the tool to explore their own challenges, along with a whole series of insights which we've discovered by looking at the problem differently. We call that the minimum viable use case. And the idea is that over time, we will build more and more of those use cases to ultimately give the minimum viable product. But because we don't know the answer when we set out, it allows us to do disciplined experimentation and constant engagement with the agency that we're working with. Now, the Data Analytics Centre started in 2015, in August. We were originally 2 people in a pot plant. No staff, no analysts, no budget, no compute capability. But all of our problems were endorsed by New South Wales Cabinet, and we had a grand total of 10 wicked challenges to work on. And that is certainly a challenge. And as we've been developing, we've tackled this very wide range of problems, which range from extraordinarily human-centric to fun things like transport optimization, fire and rescue response times. We're also operating within the New South Wales data ecosystem, which is a way of sharing data between parts of government. And it's relatively new. In fact, it's very new, and it addresses some of the friction associated with sharing data. The data ecosystem is a way for computer systems to talk to each other through what we call application programming interfaces. And it takes away the friction of sharing, but not issues of governance and of the privacy. Now, I mentioned we've worked on a very wide range of projects. I'm going to very quickly talk about a couple of them and then spend a little bit more time talking about out-of-home care. One of these problems we're looking at was the challenge of understanding the population. Infrastructure is built in all parts of the world based on a relatively simplistic understanding of the population. In Australia, we have the census, and then to project out the needs for schools, for hospitals, for water, for electricity over the coming 5, 10, 20, or even 30 years, demographers take the existing population base and then project out what the population will be based on births, deaths, inward migration, outward migration. And all of those are estimates. And you can imagine if you're planning for 30 years in the future, then the potential for getting it wrong is actually pretty high. 30 years in the future, I mentioned at the beginning, we're expecting an extra 2 billion people on the planet. And not at all surprisingly, we can expect quite a few of those to arrive in Australia. And if urbanisation is a major driving factor, we can expect them to arrive in Sydney and Brisbane and Melbourne. So understanding the population is something that's actually extraordinarily important to better understand and help demographers predict the needs of infrastructure in future. So in this case, we started on the question, how do we understand who lives where with whom at a level of detail which is appropriate for planning those infrastructure types? Schools and hospitals, water and electricity. But we also care about transport. So we used a range of ways of understanding not only the static population, but transport actually changes the population. This area we're looking at the moment is South Sydney, Randwick, Botany area. It is now the most densely populated area of Australia, and the infrastructure estimates were built on models which assumed it would never become the most densely populated area of Australia. So we said it's better that we understand the existing population. So we used not only information from census, but we used connections and disconnections of different types, water, electricity. We used credit card information, we used car park information, we used litter counts, we used any data set that we think was possible to inform the population to better understand who's currently there. But I mentioned that transport actually changes the population. So we wanted to understand not only who lives where with whom, but who travels in each day, who travels out each day, who travels around each day. And in that area, we have not only, we have people living there, we have hotels, we have a hospital, we also have a jail. So people's motivations for moving around or staying put are really quite different. So we looked at telco data, so mobile phone data, and built a 15-minute by 15-minute model of the population at what we call SA1 level to understand who's not only living there, but who travels in, who travels out, who travels around. So of the tens of data sets that we used and we calibrated against census, we got a much more fine-grained spatial and temporal understanding of the population, which greatly enhances what the demographers can do. Understanding is the first stage, predicting is a different stage. In this case, the problem we were offered is pedestrian safety. In New South Wales, we've had a constant decline of pedestrian deaths from 2011, 2012, 2013, 2014. In 2015, there was dramatic uptick, in fact, almost a doubling of the deaths compared to the previous year. 2016 and 17 also saw an increase in deaths, pedestrian deaths. So we said, can we predict the factors of risk for pedestrians? What are the temporal and spatial factors of risk? So for every square metre of Sydney, for every hour of the day, what are the irreducible factors of risk? And can we overlay on top of that the journey of a child going to school, someone going to work, someone coming home from work, someone going for a Friday night out? And just by looking through the data from, in fact, a wide variety of sources, from data sets ranging from official government data about road safety and road deaths, an understanding of population count, an understanding of a wide variety of different data sets, we were able to build these predictors and better understand for different age groups at different times of the day for different parts of Sydney what those inherent factors of risk are, and then also the modifiable factors of risk. And those modifiable factors of risk become things then that we can start to influence. Awareness is an example of a modifiable risk. Age is an example of a non-modifiable risk. So targeting interventions at those modifiable risks start to help not only the understanding, but also think about the interventions that could be used to improve the outcome, in which case pedestrian safety. But then we start to give an example of coming back to that very human-centric. So in New South Wales, our green slips, our compulsory third-party insurance, is currently the highest anywhere in Australia. There's an understood level of fraud in the system, and the number of the time to payment is very long, and the number of cents out of every dollar which is actually paid in a claim going to the claimant is amongst the lowest in Australia. So we said, let's take the Blue Sky Challenge to think about how we would reimagine insurance, reimagine compulsory third-party insurance to stop accidents happening in the first place, to identify opportunities for fraud before they happen and nudge people away from them, and redesign the system so it's very claimant-centric. And so the approach we take, I've talked about that journey of child family. In this case, it's the journey of someone who's involved in an accident. And through the lens of government data, through commercial data, through open data, build that rich picture of the understanding of that person who's involved in an accident and who then becomes a claimant and who then goes through a legal process and ultimately is returned to their family. And following that diagram down the bottom of the screen, you'll see a very crude mapping of that journey from someone paying their premiums to someone leaving home, in this case on a motorcycle, having an accident, and unfortunately in this case having an accident with a nuclear power plant, going through that recovery process, the claims process, the legal process, and return to family. And what we've been doing with CIRA, is the responsible part of New South Wales government, is helping them work with companies, telco companies, insurance companies, banks, health companies, analytics companies, to see the world differently, to build that richer picture of that journey of, in this case, a claimant, and think about the ways they could not only redesign the system, but also think about the sort of questions that they could ask and the things that they could know if they were trying to meet those goals of stopping accidents happening in the first place, or identifying opportunities for fraud and nudging people away from them. This is a work in process. The CTP scheme in New South Wales changed in 1st of December to make it more effective. And we're now working with the companies who are involved in this ideation process to make the next generation of compulsory third party completely different through this reimagined approach. So those are some light examples. This is the serious one. This is the one which probably comes closest to the interest of the group around the table. In New South Wales, there are 22,000 children in the out-of-home care scheme. It costs the state $1 billion a year, and a review done in early 2016 said that the system needs fundamental reform. We took on this approach directly commissioned by the Premier of New South Wales with the objective of improving the outcomes for children in the out-of-home care scheme. Our objective was not to save money. The objective was not to reduce the number of children going into the out-of-home care system, because we assume that there will always be children at risk of harm, but it's to improve the outcomes for the child in the system. So we took the approach, exactly the same approach, of blue sky ideation, come back to a proof of concept. And following a very similar model, we wanted to understand what happened to the child and their family, and think through the different potential points of intervention where a different sort of service or a better understanding would create a more effective outcome. And we built through linking health, justice, education, family community services data sets for every child who's been in the system for the last 10 years and their families. We built what we call ego networks. So for every single child, we build a network which is every significant person related to them, and related in the sense of significance of contact, and then create one of these networks for every single child and understand the different things that happen to the child, those different events that happen to the child in their journey. And linking justice, education, family community services, and health data, it's not a complete picture of everything that happens to the child, but it was a broad enough understanding that allows us to start to answer some pretty powerful questions. The question we settled on for the proof of concept was, can we predict for a child in the out-of-home care scheme, out-of-home care system, how they will exit the system? Adoption, aging out, return to family, or stable placement. And we can predict with very high confidence what happens to the child. A child in a certain cohort, in a certain context, we can predict their service type. In this case, it's leaving the out-of-home care scheme, aging out, adoption, stable placement, return to family. But the moment we get into human-centric service delivery, the problems become very, very complex very quickly. We found, for example, that out of the 44,000 children who've been in the out-of-home care system in the last 10 years, there was one that was connected to 40% of the entire network. 44,000 children, 137,000 related persons. One child was connected to 40% of that entire network. So the complexity of human relationships and the complexity of human interactions is definitely not to be underestimated. But by linking these data sets together and identifying cohorts in context, we could start to explore their total lifetime service contact, very much like the investment approach from New Zealand, and start to understand what happens to a child, for example, who is under 12, who may be put into residential care versus non-residential care, and identify the factors of risk associated with a certain outcome, and whether that is abuse or whether it's some other outcome. Identifying those modifiable factors of risk becomes a very powerful way of thinking through different sort of interventions. Again, modifiable factors of risk are things like awareness. A non-modifiable factor of risk is something like aboriginality. Now, I'm not going to talk about the results of that project, because as you can imagine, they really are, they're sensitive. We're working with agencies who are very strongly bought in, but who've also been doing things in the same way that they've always been doing things. Looking at research and evidence, of course, but essentially delivering the service the same way they've known how to do it based on the experience they've built up over time. And very often we have challenges working with agencies where the pushback is that the data is getting very close to personally identifiable information, or the data is relatively low quality, and therefore the results must be low quality, or the data says things which don't line up with the experience of the people we've worked with. But whatever the reason is, very often it comes back to privacy. Because of the Privacy Act, the acronym we use there is BOTPA, because of the Privacy Act. And that's the argument put forward in many, many cases as to why we can't progress further with some of these projects. So we spent a lot of time looking at what exactly the challenge is of privacy, and this is how I'm going to end my presentation. In the world of data that we work with, we are the Data Analytics Centre. We have legislation which underpins the projects we work on, which allows us to requires agencies to share data with us. So we work with open data, we work with highly aggregated data, we work with lightly aggregated data, we work with personal data, and we work with personal data with health. And at the two extremes of that spectrum, from what we call low personal information factor, very high personal information factor, at the extremes, it's actually pretty clear what your obligations are and what your responsibilities are. For the open end, essentially everything is okay. There are some limitations, but broadly speaking, everything is okay. And with personal data or personal data with health, whilst it's not fast, it's at least very clear what you need to do. Ethics approvals, continuous review, screening of people. The challenge is everything else. And that challenge exists because we actually don't know whether or not there's personal information in the data sets that we're dealing with. The project I mentioned, where we're trying to understand the population, we ask for connections and disconnections at a household level. And the answer was no, there's personal information in that. If you want that, you need to follow the pathway associated with personal information. We said, okay, let's take a half step back. What if we aggregate information over 3 months? The answer was no, same reason. Well, okay, what if we aggregate over 6 months? Same answer, no. 12 months? No. 24 months? Answer, maybe. And so the question becomes, in aggregating over time in this case, when did we cross the line from there being a concern or not concern about personal information? Similarly, we asked for data from another state-owned corporation around we said we'd accepted it at aggregation of what we call SA1 level. So that's a level of aggregation used by the Australian Bureau of Statistics to protect individual identity. And the agency we worked with said, well, if we give this to you, we'd have to think about all the other data that the Data Analytics Centre has, because there's a challenge associated with linkage. This data set connected with that data set, overlaid on top of aggregated data, potentially can re-identify individuals. And the response to that was, well, that's true, but we are the Data Analytics Centre, so we can get access to any data set in government. And the agency we worked with said, oh, that's right. They said, well, actually, you'd have to think about every data set that exists in the world. And they said, oh, that's right. And I said, well, actually, you'd have to think about any data set that would ever exist, because that leads to the same challenge. And they said, yeah, that's right. Unfortunately, that's not a very useful framework for sharing data. So we've been working with a range of organisations, including the Australian Computer Society, Standards Australia, CSIRO, different government agencies, different government privacy agencies, plus some household company names to try and understand really what the challenges are of data sharing. And after a year and a half's work, in September last year, we put out a white paper that says, these are the boundaries of the problem that we've been able to discover. This is the technical boundary. These are the regulatory ambiguity boundaries. These are the social context boundaries. These are the trust boundaries. And this is a way of thinking about the problem so that it actually starts to become tractable. So in response to, because of the Privacy Act, we can start to actually understand whether or not it's an issue about trust, it's an issue about technical performance, it's an issue about sharing outcomes, or it's a question about the concerns that an agency or another organization would have about unintended consequences of sharing of data. And it's been a really interesting exercise. The problem turns out to be very, very complex. So we've adapted what's called the 5 safes model, which is applicable to analytics projects to help us identify which parts are technical, which part are people and process, which part are judgment, and which part are essentially ethics questions. And an analytics project may be as simple as linking data together and doing nothing much more with it, perhaps just visualization. But this model, which is used by a lot of groups around the world, works well if you have 100% safe people working on 100% safe projects in 100% safe settings with 100% safe data, and then the question comes around sharing the outputs. We wanted to know what would happen if you had a 25% safe person working on a 50% safe project in a 100% safe setting. What does that look like? And how could you work through that in terms of the information you release, who you share it with, and the consequences of sharing that information. And it's been a really interesting exercise. We really are making progress to the point where we've actually working now very closely with Standards Australia to try and make this into a national standard. So I'm going to leave you now with that thought. The projects we work on ultimately are intended to address these challenges which all governments have had since governments have been around. At the most serious end, it's domestic and family violence. It's better understanding what happens with young people when they have contact with juvenile justice. It's better understanding human-centric service delivery. The methods we use rely on a rich understanding of the world around us and that journey of a child, a family, a household. Data is a way of seeing the world. Science is a way of understanding it. You put the two together, you can not only deal with the complexity of that journey, but you can do more than just solve the problem in front of you. You can do more than just doing an old thing in a new way. By embracing that complexity, by using these new tools, by being very ambitious about getting data to bring different insights and building that richer journey, you can actually think about reaching across traditional barriers and thinking about doing new things in new ways. Thank you very much.
I've got a range of questions here. Firstly, from Rodney. Rodney is a Northern Territory provider and he's asking, you're obviously a New South Wales entity and he assumes you're only dealing with New South Wales problems, but those problems also have national significance. Are there similar entities in all states and territories or other states and territories is Rodney's question.
So Rodney, great question. New South Wales government doesn't not have a monopoly on the challenge, does not have a monopoly on good ideas, and fortunately does not have a monopoly on data analytics centres. There are 2 other formally established data analytics centres, one in South Australia in Adelaide, one in Victoria in Melbourne, both focused on domestic and family violence, and we are strong collaborators with each other. In Northern Territory, there is movement afoot, and it's Hayley Richards is the person inside Northern Territory government that we've been discussing with, trying to provide not only the basis of a conversation and building a framework for a business case for developing such a centre in Northern Territory, but also providing a network of friendly, like-minded people who are willing to share. We've already collaborated on one project together, and that's also true in Queensland. It's Charlotte Crabtree, who runs the nascent version of a data analytics centre in Queensland. So we've come together in quite a few times, sharing what works and what doesn't work. We've shared as many of the mistakes that we've made as possible with our colleagues in different jurisdictions. And we're trying to provide, if we've delivered a way of doing things which works, we're quite happy to share that with different jurisdictions. But it's a great question. Thank you, Rodney.
Thanks, Ian. Question from Jeffrey. Jeffrey's with a national provider, and he reckons he's got a very wicked problem. A wicked problem that no doubt relates to service providers in New South Wales, but around the country. And his wicked problem is that he's finding it very difficult to interface with the new and great potential data source or sources now emerging from centralisation of processes by the Commonwealth, particularly through areas like My Aged Care and the NDIS. His problem is he can't get access to any of those data sources that would be contributing to the growth of his business and the better targeting of his business. I don't know how you want to respond to that wicked problem, Ian. I know from wearing another hat, the Aged Care Industry Technology Council has been doing a lot of work with the Department of Health for release of data sets, and we saw some of the data sets around packaged care released recently, I think due to a number of people lobbying for that to happen. But, you know, I guess the underlying comment from Jeffrey is there's great potential now in the system to have more robust data sets, but getting access to them is very difficult. Any suggestions, Ian?
Another great question, and yes, that qualifies as a wicked challenge because it actually speaks to all of the human-centric challenges. So the good news is that some progress is being made, and there has been a collaboration called the People-Centered Data Collaboration running for several years now, and that is essentially a group of people who are not only emboldening each other, but are also helping find practical ways to do cross-jurisdictional data sharing. The best outcome that I've seen to date is what's called DEX, the data exchange that the Department of Social Services have recently established and are now starting to link in non-Commonwealth agencies to. And so in New South Wales, not surprisingly, Family and Community Services are working through that relationship to join in. And whilst it's still sharing at a very coarse level, it's the first step in something really quite powerful. It also has a self-service component into it. The Australian Bureau of Statistics are also custodians of MADEP, the Multi-Agency Data Integration Project. And at the moment, that is only Commonwealth agencies linking data sets together, and the Australian Bureau of Statistics is exploring the use cases of that from a longitudinal data set. And as yet, that's not shared across the jurisdictional boundaries with states or territories, but the intention is that that will happen. So there's good work afoot, but the best at the moment, the best examples are still bilateral agreements, which are long and painful, working through linkage agencies like SANT Datalink, which was recently accredited as a linkage agency, or the Australian Institute for Health and Welfare, run by Barry Sanderson, who's definitely an agent of change, or lining up with the DEX folks from the Department of Social Services. But we are still relatively early in the process, and so I really feel your pain.
Thanks, Ian. I guess the DEX issue has been just the introduction of DEX has been problematic for the sector, and but I guess there is a big commitment to get more centralised data sets and more data sets that have got value to use. So thank you for your comments there. I just encourage people, there's a couple more minutes to run in our session. If you've got other questions, then now's your time to post them. Georgie's in our Brisbane office monitoring them, and whilst Ian and myself are at different sites in New South Wales. I've got another question here, a very practical one from Denise. Denise is a rural provider who has an agency that collects a lot of data and has a board that expects data collection around all aspects of the operation of her service. Of their service, and she wants to know any clues of encouraging a board to use the data rather than just collect it.
Denise, that is a beautiful question. We always start with the problem and what does the board want to know. The very first project I had was with fire and rescue, and with fire and rescue, I dealt with the commissioner at the time, and I turned up and said, "Congratulations, Commissioner, you have a project with the DAC." He said, "Who are you? What's the DAC? And how did I get a project with you?" So not off to a very good start. But because our projects are endorsed by New South Wales Cabinet, we were obliged to work with each other. So I sat with the Commissioner and said, "What do you really want to know? If you had access to all the data that you could possibly imagine, what do you really want to know?" And the process we go through is to push and to push and to push until ultimately someone says, "Well, if I knew this is what I really want to know about." So we get agencies to ask really ambitious questions. And the question in this case ultimately was, is the model, the business model that fire and rescue has, is it sustainable in the 21st century? They were designed in the 19th century, and their model is sit and wait, alarm goes off, get dressed, jump in the truck, go out to the fire, put the fire out. And the commissioner really was being kept awake at night as to see whether or not that model, that business model, would still work in the 21st century or whether they needed to adapt. So we worked with the commissioner and ultimately settled on a proof of concept question, which we could take that really high level question, break it down to several answerable questions with data, and then start to explore one of those predictors, classifiers, or what if scenario planners and give it back to the commissioner or his analytics team or his data people and start to explore the question. In the case of New South Wales, 48,000 automatic fire alarms went off last year. By law, they're required to respond, and by default, they send 2 trucks. Now, that's whether it's a real alarm, a false alarm, or a malfunction. 97% of those automatic fire alarms are either someone burning toast or the machine malfunctioning. So that's 96,000 truck rolls with lights and sirens, and 97% of the time it's toast. And if the crew arrive and they don't see smoke or smell smoke and see flames, they run the risk of not taking full precautions, so potentially put their lives at risk. So this was a little bit of a much, much bigger problem where we were able to use a wide variety of data and provide an incentive to improve the data quality and gave to the commissioner the ability to tell the crew before they arrived, best guess, this is what we think it's actually going on. Now, in order to change their business model, there's a whole lot of other stuff they need to do. It's not just the analytics, it's the business processes, it's the educational piece, in some cases it's even industrial relations. But we always come back to what would you do if you had all of that data? What question would you ask? And what's the biggest, most ambitious question you've got? And then come back to how can we prove it? In every single case, almost all cases, it's an existential question. Builder insolvency is the scheme sustainable? Compulsory third-party insurance, is the scheme sustainable? What could we do about it? So it's worth being really ambitious with your board and then decompose the problem to an analyzable challenge and then start thinking about how you'd use the data rather than the other way around.
Thanks, Ian. That's really sage advice. We've only got time for one more question, and I'm combining a number of questions, Ian. So it's a few people who've picked up on your statement and during your presentation. You mentioned of the chance of data to redesign services more appropriately and more consumer focused. The question is, there's a number of questions that relate to the structural reform that's happening within community care, both with the shift of responsibility to the Commonwealth under the old HAC program. So how the division is happening at the states with community care, and then how that's being affected by the states moving towards funding people from funding sources already, but contributing to those who are eligible for the NDIS. So that transfer of responsibility. And I guess a number of questions relate to the fact that the knowledge is that many states and territories will have responsibility for clients that they previously had. So the assumption that 100% were going to move to other entities like NDIS has been proven to be just that. But there's and understanding that the states and territories will have responsibility, particularly under community care, for clients who won't be eligible for NDIS. But at the same time, the states and territories won't have the level of funding to provide that. So I guess in summarising the questions, are you working with any New South Wales departments who are interested in how data might drive more effective, perhaps more innovative and more targeted services in the future?
So that is a doozy of a question. It has many, many aspects to it. The short answer is yes. The bigger answer is that part of the challenge that we've always had is people taking the results from an analytics project and actually doing something with it. And so I'm going to take a somewhat meandering way of answering your question. We often find that those responsible for implementing and those who pay the bills or who pick up the price tag often aren't necessarily in the same agency, and very often there's some cross-agency challenges. So taking an easy example, the Centre for Road Safety is responsible for pedestrian safety. The CIRA, the State Insurance Regulatory Authority in New South Wales, pays the price in dollar terms when someone is killed or injured on the roads. And the incentives, therefore, are not well aligned. So Centre for Road Safety obviously is doing the best they can, but they don't necessarily have the same motivations that CIRA has. And the more complex the problem is, that in that journey of child, family, household, community, the more incentives you have to align in order to really deliver an outcome. The Data Analytics Centre moved from one part of New South Wales Government to Treasury in December last year, so that we actually can help with that line of sight around the changes that are actually needed to affect the outcomes that are being sought. So the New South Wales Premier has 12 priorities, which include domestic and family violence, child and obesity, and a range of other really big challenges with, and there are numeric improvements that are being sought. And every part of New South Wales Government is aware of those, and every part of New South Wales Government is regularly held to account for them. But they're difficult to budge because of those misalignments of responsibility, of financing, and of prioritisation. So we came into Treasury specifically to try and draw those threads together. And the other thing that's very, very clear is that New South Wales Government doesn't deliver the services. So some, yes, but out of especially in the world of human-centric services, there are thousands of providers, whether they're NGOs or other organisations, who deliver the services that are effectively being commissioned by New South Wales Government. So whatever we do, the service providers need to be part of that conversation and need to be able to access data and need to be able to build the level of trust and intimacy that actually allows everybody to look at this problem in a more joined up way. So it's still early days yet. That was a fairly vague answer, I'm sorry, but the answer is yes, but we're looking to do it working both with agencies, with NGOs, and with central government.
Thanks, Ian. Great news. And I know that people in the Community Care Smart Assistive Technology Collaborative are really keen to see that the data is used more effectively than in the past to redesign really good services of the future. Thank you very much for your presentation today. It's opened up a lot of discussion in our panel, and but that's all the time that we have available for questions today. Thank you to all of those who have sent through questions. We will ensure that these are answered offline if we haven't dealt with them during the session. If you already haven't done so, please go online and register for the collaborative. You're able to access today's presentation and have an opportunity to ask further questions via the forum pages. Just by way of wrapping up today's session, in July this year, we've got a couple of upcoming events. We're hosting in Singapore and a study tour of Japan, which is in conjunction with the International Congress on smart homes and health telematics, also known as the ICOS conference. We know a lot of collaborators will be presenting papers or hopefully presenting abstracts to papers. The theme of this year's conference is design, and where participants will discuss their experience in design, development, deployment and evaluation of assistive health, community care and telehealth systems, as well as concentrating on ethical policy issues. The tour will also concentrate on aspects of living labs and co-creation and co-design, particularly in the community care settings, and we'll take in several sites and activities in Japan and Singapore. Other upcoming events that we have on the Thursday the 29th of March, one of your other colleagues from Data 61, Dr. Rob Hanson, is going to give an introduction to blockchain and how it relates to our industry. Please check the collaborative for more information on these upcoming webinars. If you have any further questions or queries, please don't hesitate to email us at sapcommunityresourcing@communityresourcing.com.au. Again, I'd like to thank the members of the collaborative research team and our expert reference group, the Queensland Government for seed funding for our site, and particularly today's speaker, Dr. Ian Oppermann. Thank you, Ian, for your attendance today, and thank everyone for their participation. Good afternoon.
Thanks very much.